Dr. Naushad Noorani. Go ahead.
So are you going to give us an introduction?
That's what I'm doing now.
Okay, thank you.
So Dr. Noorani is a consultant psychiatrist at William Osler Health System, which is part of Brampton Civic Hospital here in Toronto in the West End. He graduated from Dow Medical College in Karachi, in Pakistan. He specialized and completed his residency training in the States at Ohio State University in Columbus. He's a fellow of the Royal College of Physicians of Canada. He does a lot of volunteer work. Very modest person, just keeps working away. If not at the hospital, then he's out there in the community behind the scenes working away. And he recently stepped down as the president of Imamia Medics International, and you may be aware of that organization, which does some amazing work worldwide. They have chapters everywhere. So with that, I will pass on to Dr. Noorani. Our subject matter, as you know, is understanding and dealing with common psychiatric disorders. Dr. Noorani will speak he's got an open book. He will speak for as long as he wants to. He is aware that I had requested questions from the audience, and they have come in. I have those questions. Some of these may be included in his introductory remarks and the presentation. If not, I will pick those up at the end of his presentation, and then we will open it up to the audience. As Hasnain explained, raise your hand, etc., etc. We always say it will go from 4 to 5, but normally we find that it extends beyond 5. So it may go up to 5:15, 5:30, we don't know. We'll see how it goes. I've spoken enough. Over to you, Dr. Noorani. Thank you.
Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. Thank you, Nazmul Bhai, and thank you, the Baraza Group, for giving me this opportunity to speak about common mental health disorders and dealing with that. This is a very, very dry subject and very complex topic to talk about. And I'm glad a lot of people, about 48, I see the participants already there. So there seems to be interest. So before I start my mental health discussion, I like to start with a lighter note and tell you a joke. Actually, a few weeks ago, 2-3 weeks ago, Nazmul Bhai called me. Actually, he sent me an invite for this Baraza group, and I did not participate, of course. So he called me a few days later. He said, I sent you an invite, you did not participate. Did you not get it? And I said, no, I got the invite, but it didn't sound very interesting to me. You were talking about something about Barzakh. And he said, he started to laugh and he said, no, this is not about Barzakh. And I said, this is sound like you're talking about Barzakh. And he said, no, this is a Swahili word. It's Baraza, not Barzakh. I said, oh, I didn't know about it. So he said it means something like people get together and talk informally and so on. It's something like, I'm from Pakistan, so we call it Chopal, means like get together. So then I understood. So I don't know Swahili. I know a few words like Asante, Asante Sana, and Hakuna Matata. Anyway, this was my joke with Nazmul Bhai. So let's begin with, I'm going to share my screen. So we'll talk about, it's a huge topic, it's a vast subject. When people ask me, okay, can you talk about mental health, mental illnesses, mental disorders, I often say, what mental disorder you're talking about, what you want to talk about. It's just like asking a cardiologist to talk about heart diseases. There are hundreds of psychiatric disorders. So it's very hard to cover all the psychiatric disorder in one presentation or 1 hour. So I have picked up few topics. We will talk about the selected topics, and if people have more interest in particular areas, we'll talk more about it. So the reason that the inspiration that I have to go in medicine was this ayat from Quran. This is from Surah Al-Ma'idah, Surah number 5, verse 32. وَمَنْ أَحْيَايَ فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And whoso saves the life of one person, it shall be as if he had saved the life of all mankind. And the reason, can you all see my slides?
No.
No? So
We see another screen, your file folders.
Oh, it's not coming? Okay.
I think you need to click on the PPP or whatever, mental health PPP. No, something else. Yeah. So click on the one you already had, the common psychiatric disorders.
Yeah, this is the one. Do you see it now?
No,
Okay, I'm going to stop sharing and then we'll try again.
I think your file was open and it must be somewhere.
Oh, maybe that's why.
Yeah.
Okay, let me see. Let me close it. And then let's try again. Okay, can you see it now?
Something's coming up, but it's a blank gray screen. That's what I see.
Stop sharing.
It's okay. Take your time. No problem.
Should I open this first and share it maybe? I don't know.
Yeah, maybe go back to your file system and double click on that PowerPoint that you wanted to show.
Is it coming now?
Yeah.
Better?
Yes.
There you go.
Okay. Let's see. Okay. So then this was the ayat I was talking about. And the reason I went in psychiatry was this particular ayat. Man arafa nafsahu faqad arafa rabbahu. Means one who knows his self knows his Lord. In psychiatry, I believe that we assess the patient as a whole. In other areas of medicine, we usually focus on that particular area, but in psychiatry, we see person as a whole. So I think we understand a little bit human being better. I think that's my belief. That was the inspiration for me. So let's move into the common mental disorders. There are lots, as I say, hundreds of them. So what I did was I picked up some from one topic from children, a couple of topics from adults, and one from old age. So neurodevelopmental disorders are in children, mood and anxiety disorders are in adults, and thought disorders are also in mood disorders are also called affective disorders. Thought disorders are also called perceptual disorder or psychotic disorders. Then we'll talk a little bit about anxiety disorder and neurocognitive disorders, and they are in old age group. So there are numerous neurodevelopmental disorder in children. These are the common ones: intellectual disabilities, communication disorder, autism spectrum disorder, attention deficit hyperactivity disorder, or commonly known as ADHD, specific learning disorders, motor disorders, tic disorders, and other neurodevelopmental disorders. So there are many others. So these are the major ones. ADHD or attention deficit hyperactivity disorder is the most common one, but I'm not going to talk about that today. I'm going to actually pick autism spectrum disorder because it seems to be more burning topic, I believe, and people have more interest in that. So let's talk about autism spectrum disorder briefly. Again, I'm just touching the surface or the tip of the iceberg. There's a lot of information, but I just wanted to highlight some information so that people have a little bit of understanding. And if people have more interest, we can go into deeper discussion. So autism spectrum disorder It's a neurodevelopmental disorder in children. It is um, hallmarked by persistent deficit in social communication and social interaction. So there are two major areas where you see the deficit or problem: social communication and social interaction across multiple contexts. Deficit in social emotional reciprocity means if we are smiling, they don't smile back. If there is something to be sad about, they don't show their sadness in their facial expressions. Failure to initiate or respond to social interactions. As I said, when we go to a gathering or visit somebody, we have way of smiling, greeting somebody. These people are very indifferent. They don't interact as other people. You can see the difference. Deficit in nonverbal communication means eye contact, body gesturing, body language, facial expressions. They are different. They usually don't make eye contact or make very little eye contact, and their body language is very different than other people. Their expressions are different. As I said, if something is something there to laugh about, they don't laugh. If there's something to be sad about, they don't show that those expressions. Deficit in developing, maintaining, and understanding relationships. So, as I said, social relationships, social communication, interaction, those are the areas. So, they usually don't mix with people, socialize with people. They are kind of aloof. Other symptoms include stereotype or repetitive motor movement. The repetitive motor movements, use of objects or speech. For example, so we are talking about children mostly. They also, I mean, if they grow older, you can find those symptoms in older folks as well. So children, when they are playing with the toys, they don't typically play the way other children do. They will line up their toys in certain ways. They will do it over and over. They will flip the objects, and they also do echolalia. Echolalia means they will say the same thing when they hear from other person. Like if you ask them, "What's your name?" Instead of telling their name, they will ask you the same question, "What's your name?" And say, where are you? Where are you? Where are you going? What's your plan? What's your plan? So they will just echo what you say. Insistence on sameness. They are very inflexible and adhere to the routines or rituals. Like if they want to walk to park or school, they will take the same route. It's very hard for them to change. They would like to eat the same thing, same food every day. Like if they like ice cream, they will keep eating ice cream. Even if it's a dinner time or whatever, it's breakfast time, they like ice cream. Highly fixated interests that are abnormal in intensity. So their interests are fixated on certain things. And, we all have interest, like if somebody likes to read books, they will collect books. But this is something abnormal. I have a patient actually who is fixated in trains, Thomas trains and all those trains. So he has collected like thousands of trains in his home, and he would like to go to places where there are trains. The parents have taken the child to different countries because he wanted to see the bullet train, for example. So he went to Germany and European countries to see those trains. It's so fixated. So this is a little bit too much, I think, except normal intensity. Hyper or hyposensitive to sensory input. You hear these two words, the first line says motor, and this one says sensory. So there are two nervous system, two types of, broadly speaking, two types of nervous system in our body: motor nervous system and sensory nervous system. So whatever you do with your hands and muscles, those are regulated by the motor system, motor nervous system. Can you guys hear me okay, Nazrul bhai?
Yeah. Go ahead.
Okay. So those are all controlled by a motor nervous system. Like if you want to grab a cup of water or a glass of water or a cup of tea or something, so you move your hand, and this is called motor control behavior. And the sensory nervous system is connected with this with your sensory system. For example, if you touch something, you feel hot or cold, or you feel the temperature, you feel pain, you can smell, you can touch, you can taste. So those are all sensory stimuli. So these folks, these kids or patients have hyper or hyposensitivity. Either they are so indifferent. If you smell something, they don't smell anything, or sometimes they smell too much that you don't hear, they don't smell anything, and they say, no, I smell this thing. So they are either too hypersensitive or hyposensitive. So those are some of the highlights of autism spectrum disorder. As I said, I'm not going to go in too much deeper. Just to give you a little bit of understanding of what it is, and then we'll talk a little bit about the adults as well. So treatment-wise, currently there is really no treatment that has shown to cure ASD, autism spectrum disorder. There's no cure as such, but there are several interventions. They have been developed and studied for use with with young children. They are more effective in young children because their brains are still in the process of developing. So they work better in those folks. These interventions may reduce the symptoms, improve cognitive ability and daily living skills, and maximize the ability to function and participate in community. Treatment plans are usually multidisciplinary. One person, one therapist, or one doctor usually cannot solve all the problem or address all the issues. So there are multidisciplinary teams that work together. They involve different kind of therapies and interventions. So multidisciplinary may involve they may involve parent as well. It depends on the child's needs. Some people have, for example, a speech problem. There are some autistic children are totally non-verbal. They don't talk at all. Some talk a little bit. Some talk. Some are more advanced. So if there is a need for development of speech, then you can involve the speech therapist. If there is a behavior problem, then you involve the behavioral therapist. Behavior intervention strategies are on social communication, skill development, and reduction of restricted interest and repetitive and challenging behavior. Sometimes they have self-injurious behavior, or they are aggressive or violent towards others. So we need to involve those behavioral therapists to reduce those behaviors. For some children, occupational and speech therapy may be helpful, as I mentioned before. The best treatment or intervention can vary depending on an individual's age, the strength, challenges, and differences. There are numerous medications used in autism spectrum disorder, but as I said, there's really no cure. You cannot eradicate or totally get rid of this illness, but the medications may help in some patients with ASD to function better. For example, medication may help them with their high energy, inability to focus, if they have anxiety symptoms, frustration, depression, behavioral reactivity, self-induced behavior, or some kids have actually seizures. So there are anti-seizure medications as well. There are other alternative approaches as well. They can hear us. We can't hear you. We can't hear you. You have to check your speaker. You guys can hear me okay, right?
Yeah, I think we're fine. Hasni, you okay?
Yes, I can hear you very well. There's no issues. So I think you should just continue and don't make any changes to your audio. We are fine. From my side, I can hear you.
Okay. So there are other approaches as well, dietary approaches. There are certain dietary supplements available. Again, I'm not expert in that area. Complementary and alternative medicines like naturopathic or herbal medicines, homeopathic medicines. People try all kind of stuff when they are desperate and want to try everything. But I just want to warn people to make sure that they talk and discuss about pros and cons and side effects of these approaches. For example, some people have tried chelating agents, like this. They think that there are some heavy metals in the body, mercury, aluminum, and so on. So they try some chelating agents. Those therapies could be dangerous. But there are certain vitamins, herbs. I don't see there is any problem. But if they help, why not try? So that was about autism spectrum disorder in brief. I'm going to talk about a couple of common adult problems in adults. So mood disorder seems to be the very common problem, and there are lots of mood disorders. For example, these are the major mood disorders. Major depressive disorder, dysthymic disorder. It's also called persistent depressive disorder, seasonal affective disorder. Actually, I'm going to describe briefly about this one. We are not going to go in detail. We are going to go in detail about major depressive disorder. So dysthymic disorder is actually chronic low mood, usually lasting for more than 2 years. That's why it's called persistent depressive disorder. Seasonal affective disorder affects in certain seasons, especially winter time, especially in this Northern American hemisphere, where we have very little sunlight. Perinatal depressive disorder, you must have heard postpartum depression, postpartum blues. So it's related to maternal depression during pregnancy and after the delivery. Bipolar disorder, just like unipolar depression, depression is also called unipolar depression, but there is also bipolar disorder or bipolar depression, where people have not only the depressive episode, but they also go very, very high. We call it mania. So it's also called manic depression or highs and lows. That's why it's called bipolar, two pole of a mood. Cyclothymic disorder, again, it's very similar to bipolar disorder, but the symptoms are not as robust. There are slight ups and downs throughout their life for a long period of time. That's what's called cyclothymic disorder. Schizoaffective disorder, it's a combination of affective disorder. By the way, anybody knows the difference between mood and affect? We have used two words here. In bracket, I've written affective disorder, mood. What's the difference between mood and affect? I see that there are a few doctors in this group too. I see Dr. Heather Fazal and some other doctor. I think Dr. Akbar, I don't know if it's Dr. Akbar Mikani. But anybody besides those doctors know any difference between mood and affect? Any volunteer? I'm not going to judge you.
So you can go ahead and unmute and answer the question if you want.
Yes, unmute and answer if you want to take a chance. No?
Hold on. We have a
Yes, go ahead.
behavior and expression from Adil. Behavior and expression.
Behavior and expression. Close. Anybody
Okay.
else? No. Okay. So just like there are two words used together, signs and symptoms. Do you know the difference between signs and symptoms? Anybody? Not the doctors. You have to unmute. Whoever wants to talk, unmute first.
Hello.
Okay. Again, PE and history from Adil.
PE and history. What is physical exams and history? Again, closer, but not quite. So let me, just for the sake of time, signs are the ones that people experience. For example, I'm having shortness of breath. So I have signs of shortness of breath. If the doctor examines me and if I don't complain that I have shortness of breath, and he feels that there's some problem with the lungs when he hears the stethoscope, and he said, "Oh, do you have symptoms of cough or shortness of breath or something?" So those are the symptoms that the doctors notice, and signs are the symptoms, are the manifestations that the person describes. So mood and affect are very similar. Mood is what you describe. So for example, if I say I'm in a good mood, I'm in a great mood today. So that's my mood. But if you see me that I'm not in a great mood, I am actually a bit anxious, or maybe I'm looking a little bit sad. So what my expressions are telling you, that's called affect. So the mood and affect can be different. They are not always going to be similar. So for those people, for those folks, autism spectrum disorder, as I said, if there is something to be happy about, they don't show the expression. So their affect is not congruent or same as their mood. If they're happy, they don't show the happiness. So anyway, let's move forward. Schizoaffective. So schizoaffective disorder is a combination of affective disorder, means mood disorder, and psychotic disorder. Psychotic disorder, when you lose touch with the reality, like if you have hallucinations, delusions, paranoia, and so on. So the combination of both psychotic disorders and mood disorder are called schizoaffective disorder. Substance-induced mood disorder. Mood can change with substances like alcohol and recreational drugs. Mood disorder due to general medical conditions. Some of the medical conditions can cause mood disorder as well. Unspecified mood disorder means there are so many other mood disorders, they may not fit in these categories. So let's talk about a little bit about depression. So depression is a common mental disorder. Globally, more than 264 million people of all ages suffer from depression. It's a leading cause of disability worldwide, and is major contributor to the overall global burden of disease. It is more prevalent in women than men. We all go through depression actually every now and then. That does not mean that we suffer from depressive disorder or depressive illness or depressive sickness. Depressive disorder is actually a very particular, there's a particular definition of disorder. But if you're having a bad day, blue day, down day, it does not mean that you qualify for a major depressive disorder. You don't have disorder. We all go through, when we hear a bad news, yes, I will have a bad day. I'll be depressed, I'll be sad, I'll maybe crying. And if I hear a good news, I may have a good day, a great day.
किसी से कहना कि आवाज खोलें वो, जब तक उधर से आवाज नहीं खोलेंगे मैं सुन नहीं सकता उनको.
What was that? I think someone's
Someone saying
muted.
they cannot hear me, I think.
Oh, I see. I think the rest are okay because I haven't heard anyone complaining.
Nobody else is complaining?
Yeah, I can hear you very well, so there's no problem. Okay. I think we should just continue.
Okay. So what I was saying is we all experience depression every now and then. That does not mean that we have depressive disorder. There's a specific criteria for major depressive disorder. So it has to be persistent. So persistent depressed mood or loss of interest or pleasure in daily activities for more than 2 weeks. So minimum time is 2 weeks. It can be longer. It can go on for months and years, but minimum. So if you are having a bad day or two, that does not qualify for major depression. And the mood has to change from the baseline. Some people have depressive personalities. They are depressed all the time. They're always complaining. So again, they don't usually qualify to fall in major depressive category, because this is their baseline. They're always depressed, no matter what you do. They always complain. But if somebody is happy, you see them all the time. They are, very social, lively, and all of a sudden they are down. They are not social. You don't see them. You don't see them. They're laughing, smiling, joking as they were before. So they have to be changed from the baseline. And also, this change of mood impairs your functionality in social, occupational, and educational fields. Like, for example, as I said, you isolate yourself. You don't want to talk to other people. You don't take interest or, play golf or tennis that you used to in the past. Or you stop going to work, or stop your education or classes, or taking interest in things that you used to enjoy in the past. So it has to impair your functionality. For example, if somebody has depression, a little bit of depression, but they still can move on, they go carry on with their life. They still work. So maybe they have depression, maybe they don't have major depression, maybe not as robust, not as severe, or maybe they have mild depression. So there are certain specific symptoms. There are 9 listed here in my list. And according to DSM is a diagnostic book for mental illness. And that has criteria. So it has to be at least 5 out of 9 symptoms to qualify to fall in this category. And they are depressed mood, as I said, or irritable most of the day. Irritability is also part of depression, by the way. When people are not happy, they are actually sad or irritable. They start arguing all the time. So that also sign of depression. So it has to be nearly every day, as indicated by either subjective report. The person feels himself, or the other people, like in the family, they observe that too. Decreased interest or pleasure in most activities, most of each day, significant weight loss. So their appetite changes significantly. They don't like food, they don't like to eat, maybe they barely eat 1 meal a day or something, and they lose weight. This is more in most cases. Some people, however, eat more actually when they are more depressed, more sad, but again, those are rare. Most people have loss of appetite. They also don't sleep well. Their sleep pattern changes and they don't get enough sleep. They have insomnia, but again, some people sleep too much, hypersomnia, because they are bored and they want to avoid people. They want to interact with people, so they just isolate and hide in their room. Change in activity means they act slowly. They take a long time to come out, answer your phone, or do activities of daily living very slowly. So we call it psychomotor retardation when they do slowly. An opposite of this is agitation, when they are very hyperactive, agitated, aggressive, or irritable. Since they are not eating well, they are not sleeping well, or sleeping too much, they have loss of energy as well. They feel fatigued, lethargic most of the time. Feelings of guilt or worthlessness. This is abnormal or excessive amount of feelings of guilt. We all sometimes feel guilt over something, but again, this is like inappropriate or disproportionate. Lack of concentration. Everything goes down basically. Concentration goes down. You cannot focus, concentrate, finish the task, and then become more indecisive. Suicidal thoughts are also common in patients with the depression. They sometimes make plans. They start, writing notes, giving away their belongings in a plan to end their life. Causes of depression, we don't know the exact cause. Actually, we don't know the exact cause of any of the psychiatric disorder, to be honest, or many of the physical problems as well. So there are different risk factors. If the family member has depression, then there's a possibility that you might get depression as well. So it runs in the family. Early childhood trauma can cause depression as well. Some people have brain structure or biological defects that may cause depression. Brain chemistry or neurotransmitters, or we call it chemical imbalance. So there are lots of chemicals in the brain. When I was studying biochemistry, I remember in my first year of medical school in Karachi, Pakistan, Dow Medical College, I was reading a book, and this book was written by a Pakistani author named Mushtaq Ahmed, I believe. It's been like 30 years. So the first page of that book had a share, like a verse, and it was actually beautiful. So I like to recite it if you don't mind. It's in Urdu, and I can translate it and explain it. So it says, "Zindagi kya hai? Anasir mein zahur tartib. Maut kya hai? Inhi ajza ka pareshan hona." Means, what is life? Life is actually the balance of chemicals in your body. And what is death? Disturbance of all these chemicals. So if there is slightest disturbance in our body, like for example, if you have high sodium or low potassium, or some other, chemicals are imbalanced, you can die very easily, very quickly, actually. Uh, Same with the brain. Brain has lots of chemicals in our body. For example, they are called serotonin, acetylcholine, dopamine, epinephrine, norepinephrine, GABA, and so on. There are lots of them. So if there is an imbalance between these chemicals, um, we may suffer from mental illness. And one of the major neurotransmitter in the brain is the serotonin. So scientists believe that there is a lack of enough serotonin in the brain that triggers depression or anxiety. Hormonal changes can cause that. For example, we talked about perinatal or postpartum depression. So women go through a lot of hormonal changes. And in old age also, when women go through menopausal changes, and sometimes during their menstrual periods, menstrual cycle also, they become moody, and the hormonal changes can cause depression, anxiety as well. Some medical conditions can cause depression as well. For example, hypothyroidism, lack of thyroid hormone, can cause depression as well. Drug use, alcohol is a big component leading up to depression. And there are other recreational drugs. People get high on cocaine, but when they come off the cocaine, they suffer severe depression. And actually, some people even feel suicidal when they're coming off cocaine. Treatment. Again, I'm just touching all these areas, not going into too much detail. Just to make you aware what it is, and if you have particular interest, like for example, depression is a very common problem. We can even talk more in detail about it if people are interested. I'm just going to touch base. I don't know how we are doing with the time, but I'm going to just go quickly. So treatment.
Okay. Dr. Naushad,
yes.
I was just going to say that, if you can finish off this treatment, the depression section,
Yes.
and then we'll go into the questions. It's 4:46.
Oh,
so, yeah.
okay.
No, that's okay. I know there's lots of information to be shared.
Okay.
But let's finish this section and then we'll go to questions.
Okay. So treatment of depression. There are lots of antidepressants out there, and their names are here. All medications have two names. For example, Tylenol is called acetaminophen, Advil is called ibuprofen, and so on. So fluoxetine, for example, is Prozac. Sertraline is Zoloft. Paroxetine, citalopram, escitalopram, duloxetine, venlafaxine. These are all the funny names, fancy names for medications, antidepressants out there. And there are classifications out there. I'm not going to go in detail. Besides, so sometimes we combine these medications as well. Sometimes we augment this medication with different other medications. There are other therapies, for example, electroconvulsive therapy. This is also used as shock treatment, as it's commonly referred to as. There's also another stimulation therapy. It's called repetitive transcranial magnetic stimulation, RTMS. That is becoming more popular now. It's a very new therapy, so we don't know much about it. Psychotherapy, and of course, counseling and alternative treatment, as I said, naturopathic, herbal medicine, supplements, vitamins, if you want to use that, that's fine. Okay, so I was going to talk about anxiety disorder, and then I have actually neurodegenerative disorders as well in line, but I think we are quite, it's going to take a long time. So I don't know, Nazmul Bhai, you tell me. You want me to stop here or pause here?
Okay, I think what we'll do is I'd ask the participants to send in questions. So just in fairness, we have about 12 minutes before 5. So in all fairness, let me ask you a couple of questions, yes. And then we'll decide if there's interest. We'll continue. So the first question from 2 or 3 different people was related to the COVID-19, the lockdown, and all that, and the effect it's having. So what will be the long-term effects of social isolation and stress due to COVID-19 on our children and seniors who are prevented from having social contact? Related to that COVID-19 is another one. How do wage earners and business persons maintain their sanity when they lose their livelihood due to COVID-19, you know, more pressure and all that. So there is this question, and then, you know, I have one or two more.
Okay. I thought we have had so many sessions on COVID-19 or coronavirus. Maybe people may not ask too many questions about it, but it seems like people still have more questions. So anyways, yes, this is a difficult time we are going through, and we are all in it together. Inshallah, we'll get through it. This is not the first time, as I said in the past, we have had many pandemics before. Actually, in 19th century, 1918, we had Spanish flu. Actually, we were not born at that time, but there are people who are still alive these days. I actually just saw today, actually, an interview on CNN. I mean, I didn't watch the interview, but I saw that there was a news about it. There's a 102-year-old woman in New Hampshire. She survived the Spanish flu pandemic in 1918. You know how many people were affected during that Spanish flu? 500 million. 1/3 of the population. Population was less than 2 billion at that time. So 1/3 of the population was affected by Spanish flu. So this coronavirus of COVID-19 is not as bad so far. So, you know, I always look at the glass half full and stay positive. You know, as they have gone through that huge pandemic at that time, inshallah, we'll go through it too. So stay positive. You know, people who have lost jobs or laid off or whatever financial stress they have, they still should thank God that they're alive. They didn't get infected with COVID-19. You know, this is how I see. When I wake up in the morning, I always thank God that I'm alive. I can walk, I can talk, I can see, I can hear, I can smell. I have strength. You know, if I don't have money, we are blessed that we are in this country. You know, government is, you know, helping us so much. $2,000 if you don't have job. I mean, this is more than enough to survive. We have actually expectations too much. I think our lifestyle is, you know, are too expensive. If we have big houses, big cars, you know, mortgage to pay, yes, of course, you're not going to be able to do it. But is this necessary? I mean, for survival, I think you just need $2,000 a month. That's what the government thinks it is enough for you. And if you have children, you get further grant. So my point is, yes, it is a depressing time. It is depressing. If I lose a job, I will not be happy. Yes, of course, but I would not be very hopeless. You know, I always think I have changed so many times. I've moved from, you know, one area of the country to another. I used to work in British Columbia, all the way in northern area, close to Alaska. Then I went to Nova Scotia. I changed so many jobs. Thank God. Thank God. I have always got a better job, always for better. So what I say is, if you lost this job, maybe there's something better in future for you. Allah Ta'ala is great. So don't give up hope. Inshallah, I cannot, you know, if you're really losing hope and you're becoming very, very sad and depressed and anxious, you're losing your sleep over it, then get help. You know, you may need some medication, you may need some therapy, counseling. Yes, there are specialists available to help you. But in short, you know, this is the reality. Yes, I mean, I go to work. I didn't lose my job, but do you think I'm happy to go to work? I walk into the hospital. It's just like walking into a war zone. It's really like you have to wear a mask and all the shields and wash your hands 100 times a day. And you don't know who you're going to meet next, who may be positive for COVID. So I am more scared than you are. You're staying home with your children and I'm staying in the hospital working in the front line. But anyways, we all face, you know, this is life. We have to move on. We have to lower expectations. It is going to cause depression. It's going to cause anxiety. Of course, there's no doubt about it. But again, we have to, it's all about managing, how you manage the anxiety and stress. As I said, stay positive, stay healthy, get enough sleep, eat properly, spend some time doing reflection, praying with your children, going out for walking, exercise, do your activities, and be happy and be positive. And if you need help, there are specialists available.
Thank you so much for the detailed explanation. This question again came from 3 people. How does time spent on technology impact mental health, particularly for kids? And of course, during this lockdown and all that, and online learning and all that, they say kids should be out and about, playing, running, whatever, and all that. But there is less of that now. So how does it affect them? And also the effect and the use of extended time on technology by the seniors. Will it have detrimental effect? Thank you.
Social media is used for socialization, right? We are in social isolation. Actually, I shouldn't say social isolation. We are in physical distancing, physical isolation. We should not be socially isolated. We should be in social contact. The problem is there has to be a limit to everything. Water is necessary for our life, but you cannot keep drinking water all the time. It may cause water intoxication. You may die of water intoxication actually. So excess of everything is bad. It can become poison. So yes, limitation. We all have to limit our social media. Now there's really no guidelines which says that, okay, you have to use half an hour, 1 hour every day, but use your common sense. If you're spending too much time and hiding from problems, then yes, it is not healthy. If you're spending too much time on social media, I think there's so much misinformation and misleading information on social media. So I really don't want to see all of those. So many groups going on. You don't have time to see even those messages, let alone you're going to respond to all of them. You're not able to even see those. So yes, you have to limit yourself. I don't know how much time to spend, but people I've seen, they are praying and looking at their messages in the prayers, and they have phone right in front of their sajdaga. They cannot live. I mean, this is too much. You have to turn your phone off, put it on the side. If you're going to bed, sleeping, or going to pray, it should not be there. You're connected with Allah Ta'ala, so no more social connections. So yeah, you have to limit. So kids are spending too much time for sure. I know if you have any formula for the kids, let me know too. But I think kids are like monkeys. I always say monkey sees, monkey do. So it's what they see. If we have to follow the rules. So if we do the limitation in our social gadgets and stuff, then they will limit too. You can tell them the timings. You can do half an hour, 1 hour, whatever, and then you have to no gadgets on the meal table or dinner table. Prayer times, no gadgets and stuff. You can spend time together, play some basketball, or go outside in the park or something. So yeah, you cannot just say, okay, you don't need to use the cell phone or tablet, but I'm going to use it. So what they see, you have to set the example. So you set your time and then let them use their time too. Yes, it can cause problem if it's too much, as I say, too much toxicity. Too much use of media can cause toxicity. And old age people, if they are using too much and not actually talking to other people physically, or interacting with people, even on the social media, but just watching some videos, movies, and stuff, I think it's not healthy. Maybe you need to limit it. Maybe there's something going on. Maybe they're suffering from depression or anxiety. They are hiding it. They just want to isolate themselves and don't want to interact with people. So it's not healthy. Yes. So limit. Take breaks, prayer times, walk times, play some sports, do some activities, and don't be on the gadgets all the time.
One more question from me. It's 4:58. We'll see, and then I'll ask again if we should continue. But this question is herbal medicine really effective, or is it mostly a placebo effect?
There's no 100% cure in also allopathic medicine for lots of things. So some of the herbal medicine are effective. I wouldn't say every medication is effective, but I think I'm not expert, to be honest. I shouldn't be speaking for the herbalist, but I have seen many patients. I have lots of patients who are using all kind of stuff, and I'm not against any of these. Actually, I'm actually in favor of them. If they work, fine. I have no problem. As long as they don't cause any side effects or a worsening effect, I have no problem. So if they are using, for just to give an example, melatonin. Melatonin is for sleep. They say it's a herbal thing or it's a natural thing. There's no chemicals in it or whatever. No problem. If it helps you sleep better, use it. No problem. And there's some people use it and it works. Now, do all herbal medicines work? I don't think so. But again, I'm not.
Okay, one more quick question, and I know there's a straightforward answer to this. You've done such a wonderful job so far. There are people asking, do you take new patients? Or what is the process?
I work at Brampton Civic Hospital, William Osler. You need a referral. And yes, my wait list was too long, but for community, I make exceptions. So inshallah, if anybody needs any help, you need a referral from your family doctor or a physician and fax it over to William Osler. I can provide your fax number and then we can schedule a consultation.
So should I take over now, Nasmulba, or you have more?
I was going to say,
I have a question.
Yeah, just a minute, just a minute. I was just going to say, it is 5 o'clock. There seems to be interest. I have a few more questions, and I was going to ask Hasnain to take over. So what we will do is we'll continue, and if you have to leave, not Dr. Noorani, you stay.
No, I'm here also.
But if any of the participants have to leave, we won't be offended. Thank you for your participation for this meeting, for the previous meetings if you did. And if we do decide to continue in maybe September, then we'll certainly, we have your email addresses and WhatsApp and all that, so we'll notify you. But meantime, enjoy summer, and be well, be safe, be all that, and we'll continue. So Hasnain, there's one question I wanted Dr. Noorani. Excuse me, can you please go muted before you continue your private discussion, please? Sorry, the question is, how does one improve mental resiliency? And I think you touched on that. What lifestyle factors can impact, increase, or reduce one's susceptibility to mental illness? You touched on the attitude and positive and all that, right? But is there anything else they can do apart from that?
So basically, balanced lifestyle is the key. Balanced lifestyle. As I said, excess of everything is unhealthy.
All right, Nazmul, I have a question afterwards.
Yes.
So routine, your workout, a little bit of walk, exercise, sports, get enough sleep, healthy sleep, 8 hours at least at night, not during the daytime. Eat healthy, and be positive. I know it's easy for me to say, but as I said, I always look at glass half full, not glass half empty. So if you look at that way, I mean, there are so many people in this world who have so many life-threatening illnesses. They have cancer, for example. The doctor has given him time. You have 2 months to live or 2 years to live. When you have mental stress, you have laid off, you're anxious, or you're depressed, you're not losing your life at least. You have life. You can move on after that. You don't have only 2 months to live. You don't have 2 years to live. There's no limit for your life. You're at least healthy. So that's how I see. I always see things positive, things to get better, inshallah, in the future. So just have a faith in your religion and yourself.
Thank you. Hasnain, you take over. I think
okay.
Someone wanted to ask.
So I'm going to ask a question first, and then I'll let, I think it was Yusuf I wanted to ask. So let me ask this question. It's related to personality. There are 2 related questions, right? So the first question is, can personality be a risk factor? And then the other question is the type of personality that are more prone to depression. So if you can answer that, please.
Okay. So I think the personality, the question was the personality is a risk factor for depression, maybe. I think that was the full question. It's just
Yeah. Can personality be a risk factor?
risk factor for what? For death, for suicide, for anxiety, for depression, for schizophrenia, for bipolar.
Okay, so there's
risk
no...
factor for probably some sort of mental disorder, maybe.
Probably.
Yeah. So you see, that's a problem in the community. That's why I wanted to talk a little bit about this mental disorder, because people think mental disorder is a one disorder only. It's not one disorder. There are hundreds of disorders under mental disorder. So anyways, there are lots of personality disorders. There are lots so broadly speaking, there are 10 different types of personality disorders. They are categorized in 3 clusters or classes, cluster A, B, and C. So there are like schizoid, schizotypal, and paranoid personalities. In cluster B, there's like antisocial, histrionic, borderline, and there's one more. And then there's cluster C, avoidant personality, obsessive compulsive personality, and dependent personality. So there are lots of personality disorders. Yes, some personality disorders could be a trigger for some sort of mental disorder, especially anxiety and depression. For example, people who are avoidant means they avoid people. They like to stay by themselves, so they don't interact socially as much. Yes, they could be at risk to develop a depression. Schizoid or schizotypal or paranoid personality disorders, people are at risk to develop psychosis or schizophrenia. Antisocial personality disorder are psychopaths. They are sociopaths. They can end up in jail. So they have no regard for other. Basically, they're antisocial. So they take gratification in other people's suffering. So they can cause harm to other people, vandalize, steal, lie, cheat, and those kind of things. So they are at risk of ending up in jail. So yeah, there are lots of personality disorder, and some personality disorders can be a risk factor to develop some sort of psychiatric disorder.
There was somebody who wanted to ask a question. Do you know who it was, Nazmul? He can unmute and ask.
Yeah, sorry, I didn't recognize the voice. Who was it?
Yusuf Sivji.
I see.
Oh,
please go ahead, Yusuf Uncle.
Yusuf Uncle is the big boss. Go ahead.
On Tuesdays only. Okay, Dr. Saib, I have a very tough question. So I'm not trying to make life difficult for you, but I just was curious.
If I can.
Yeah, I was curious as to the religious side of this thing. In other words, if somebody does something that is sinful, terribly sinful, like he shoots somebody for no reason at all. Now we are told that Iblis, when he left Jannah, he left the group of angels, he was given permission to be able to go in and corrupt some minds of people, of humans. So how does your branch of science deal with that?
So yes, I was actually going to touch base on that one in my presentation about stigma. Stigma of mental disorders, mental illness. There's a lot of stigma, as you know. Actually, there's a stigma in every culture, pretty much. But in Muslims, especially in Islam, there's a lot of stigma about mental health as well. And I think that comes from that particular thing that you mentioned about sinfulness, and also about the shaitan and iblis, and people go to Maulana and ask for dua and some taweez or something to get rid of shaitan or evil spirit. There's nothing wrong with that, and I believe in that too. If I have problem, I pray to Allah and recite surahs and stuff. There's nothing wrong with that. Absolutely nothing. Actually, it's good to have that because this is our strength, right? The problem is when you cross certain boundaries, certain borders between religion and hyper religiosity, or delusional beliefs. Let me give an example. I'm originally from Pakistan. 35 years ago, I was in Pakistan, and at that time, I heard the news. There was a group of people, like a family member, the whole family, drowned in ocean. The whole family drowned, and they were put in a coffin. And because this guy, the head of the family member, saw a dream, the Imam came, or Imam Mehdi or somebody came in his dream and told him that you all have to die and drown in the ocean. So he takes the whole family, put them in coffin, and throw them in the ocean. And there was a news that the whole family died. Like 14 people in the family died. I don't know. I don't remember the number. Don't quote me. But yes, there was a big news, and I said, "Oh my God, this is religion? I mean, what is this?" So what do you think about that thing? So when you cross this boundary, this person definitely crossed this boundary and went beyond the normal religious belief. So as long as somebody is doing sin and they are repenting and asking for forgiveness, there's nothing wrong with that. But if you go beyond that, religious belief, and you feel that, oh my God, I did this sin, and I should not forgive myself. You have so much guilt that you feel that you must be punished, you should die. That's not normal. Yes, you have done the sin, you're regretful, you ask for forgiveness, and if you feel very, very worthless, hopeless, depressed, then you need to get help. It's going beyond normalcy. It's not normal to go that far. So I don't know if I answer your question in my convoluted speech.
Hassan, continue, please.
Yeah, okay. So we will ask the next question. Are psychiatric illness more common in women? If so, any reason or explanation? And to that effect, can you also talk about effect on different genders or race or nationality? Please go ahead.
So psychiatric illnesses are throughout the board in every nationality and ethnicity. Again, the question is, mental illnesses are common in women or men? Now, mental illness, again, is not one illness. There are lots of illnesses in men. For example, postpartum depression. Men don't get postpartum depression, right? Postpartum is for women after the delivery. So yes, it's common, and it's only on women. And same with the mood changes related to their menstrual cycle. Yes, it's common in women, of course. Menopausal, again, they go through hormonal changes, and it's only for women. Now, there are certain other illnesses, they are more common in women than men. For example, anxiety. It's like 10 times higher than men. Women tend to get more anxious, they panic easily compared to men. So yes, they are very common. Now, what is the cause of that? I don't know. It's just their personality, it's their nature. They tend to become very anxious, worried, they become over analytic of things, undecisive of things, and so on. Depression is also very common in women. Again, it may have something to do with the hormones, possibly, because as we see that during the pregnancy and delivery, after delivery, a lot of women go through postpartum blues and postpartum depression. So it has to do with the hormonal changes. All of a sudden, some of the hormones drop, some of the hormones are high. So definitely it has to do something with the hormones, but I don't know exactly what the mechanism is, and I think nobody knows. But yes, depression is also common. Anxiety is also common. Schizophrenia, however, is equal in men and women pretty much. Bipolar disorder, I believe it's more in men than women. Substance abuse disorder is more in men than women. What else? Autism, I think it's pretty much similar. ADHD is very high in boys and then girls, like 10 times higher in boys and girls. ADHD, attention deficit hyperactivity disorder. So yeah, there are certain psychiatric disorders. They are higher in women, but they are higher in men. Antisocial personalities are high in men than women. So yeah.
Hasnain?
Okay, so I've got two more questions. what is the effect of catastrophe in life in causing depression as compared to other causes?
Okay. So catastrophes. Catastrophes are life-threatening events in our life, basically. For example, this coronavirus is also one of them. But mostly, like we talk about, for example, earthquakes, flooding, fire. Some you get involved in like crossfiring or rape, for example, or abuse, or something which is very life-threatening, catastrophe, as you said.
Or
Uh,
family death as well, I guess. Family death.
Family death, again, it's a normal thing actually.
Yeah.
Family death is very normal. We all going to die. So death is not classified as catastrophe. Catastrophe is something happened out of the blue and you feel that, oh my God, I'm going to die. Earthquake, okay, we're all going to die. This is all. There's a fire, okay, life-threatening. Somebody is getting raped and the person feels, oh my God, this is it. This person is going to kill me, basically. So life-threatening event, which is not normal. I mean, all of a sudden that happens, but death is common. It's going to happen. You know, it's just a matter of time when. So that can lead to, we call it post-traumatic stress disorder, PTSD. So after trauma, people go through a lot of anxiety and depression. Yes, it can lead to depression, it can lead to anxiety, which is termed as post-traumatic stress disorder. It's not necessarily going to do with everybody. See, everybody's tolerance is different. For example, if you're going in a car with 4 passengers in it, one driver, 3 passengers, for example, and you see an accident on the road, somebody is crashed a car, and you see somebody's on the road and bleeding. 4 passengers in the car, you want to come out and say, oh my God, let's help. The other person said, no, 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 don't go out. Oh my God, let's go, get out. Can you drive the car, please? I cannot even see this scene. And you can say, are you crazy? You know, this person is dying. Let's save them. No, 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 I cannot sleep. I cannot sleep. So everybody's tolerance is different. Somebody wants to help and do whatever they can. They don't care about blood or somebody's dying. They want to help. But some people, they come home and they cannot sleep all night and they have nightmares because they saw this blood and person dying and they just go on all their life and they develop even post-traumatic stress disorder because they think, oh my God, this person is dying, I may die too, or something happens. So anyway, their tolerance, their threshold for tolerance is very low. So those people are at high risk. But not everybody is going to, like if there's an earthquake and somebody survives and they may not suffer from PTSD. But some people may suffer from PTSD. So it depends on their the tolerance.
Okay, so I have one question and I'll ask this question before we pass it to Nazmul Bhai. So what is the role of faith in dealing with mental illness? Role of faith. Good
question. Faith has very important role to play actually. There was a study actually, I did the presentation long time ago about the faith and mental illness actually. It was very interesting and I read a lot about it. So faith has a lot to do, it is very positive actually. People who have faith, for example, people who have faith do not get many mental illnesses, first of all. People who have faith do not think about suicide. It's a preventative, what do you call, aspect in terms of suicidality because the religions don't permit suicide basically, right? It's haram, right? So people don't even think about it. And if they think about it because they have no control over it, they don't follow through. They don't go through it. They don't complete suicide. They think about it, but they say, no, 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 this is against my religion. So faith is really very protective aspect. So they stay healthy, not mentally, but physically as well, because they pray, 5 times. They do wudu. They stay clean. They, take bath, ghusl, and then exercise. So there are lots of positive things about religion, faith. In old age also, people who follow their faith, especially in Islam, they also don't get as sick physically and mentally. Also, they don't get as much dementia. I was going to talk about dementia, neurodegenerative disorders, as much. Again, we are all going to have wear and tear of life. You know, we are going to lose our hair, our hearing, our teeth, our all the marbles, uh, slowly. But people who have faith, they are stronger, so they can survive longer and stay healthier, both physically and mentally. So they don't become so hopeless because they have faith in their Lord and their religion. So, anyways, faith is a positive aspect in terms of mental illness and also physical health.
Can I ask the last question, please?
So Nazmul Bhai, you go ahead, ask your question, and I have another question here if there is time. So, and then we can give to Yusuf Bhai after.
So
okay, thank you.
We still, Yusuf Bhai, just we have 44 participants, which indicates to me that, you know, there is interest. It's already 5:20. So
if they're interested, no problem.
I think Dr. Noorani will start his time clock.
I am actually, I feel honored, to be honest.
No. You. Thank you so much. Thank you. I have one specific question here, which was sent in. OCD, the obsessive compulsive disorder. How can that behavior be changed? But before that, what brings it about?
OCD, obsessive compulsive disorder. Again, it's a whole big topic. It's a whole new subject to talk about. It's actually classified under anxiety disorder. There are lots of anxiety disorders, and this is one of them. Post-traumatic stress disorder, as I mentioned just now. That's also an anxiety disorder, generalized anxiety disorder, acute stress disorder, separation anxiety disorder, panic disorder, or OCD, obsessive compulsive. They're all anxiety disorders. So obsessive compulsive, as the name suggests, there are two, things in this disorder: obsessions and compulsions. So obsessions are thoughts, and compulsions are behavior. So thoughts, repetitive, disturbing thoughts, are called obsessions. And behavior, repetitive behavior, rituals of washing hands, counting, recounting, checking, rechecking, arranging, rearranging, closing, opening, turning on and off, and those repetitive behavior is called compulsion. Anyways, this is the definition of OCD basically. What causes OCD? We don't know. The first answer. There are lots of, however, factors that can contribute. People who are anxious, their anxiety can lead to OCD because they worry too much. They worry too much. For example, if they worry about germs, their hands are not clean. So they will wash their hands over and over and over. They can become OCD. So if you wash your hands once or twice, probably not a problem. But if you start washing your hands 10 times, 15 times, 20 times, and then you spend so much time that you're late for your office, late for your appointments and stuff, it becomes a problem. So people who have anxious or anxious personalities, they can develop OCD. They may, not necessarily they will, but they are at high risk. What else? There could be some other medical condition that can contribute to OCD, I guess, not cause it. The cause is not really known, to be honest, but there are certain factors that can contribute to it, and anxiety is a big factor. Treatment. For pretty much all psychiatric disorders, we use two modalities. One is the medication that you all know, and the other one is therapy, counseling, psychotherapy, whatever you want to call it, talk therapy, basically. So there are medications available. Again, OCD is very, very tough illness to treat, very tough. I had a patient who was like in his 90s, and he suffered from OCD all his life and was so like mortified by this illness. And I tried everything possible and I couldn't get rid of. I mean, getting rid is very difficult, but at least if you can improve the lifestyle and make it a little bit easier, that's the goal, which is also hard. So anyways, medications are there that can help you. Antidepressants are usually the treatment of choice for for OCD. There are lots of antidepressants, as I named a few in my presentation. And anti-anxiety medications, for example, benzodiazepines are also commonly used. And therapy, counseling, talk therapy, and getting some religious counseling as well, if they are Muslim, of course, praying to Lord, their help in Quran and Hadith to seek help in that area. But there are special counselors who can help patients with OCD in this area. There's actually a specific type of therapy. It's called exposure and response prevention. So, for example, if somebody has OCD with germs, they have germ phobia. They are scared of germs, so worried about germs. So they are exposed to germs. For example, they say, "Oh, this is a phone, and I touched it. Look, my germs are there." And now you touch it, and they say, "Oh my God," they have fear. "Oh, now I'm going to get all the germs from the person." So you have to expose slowly, and then you have to prevent their response to wash their hands. So this is just an example. There are lots of people have fear of heights, fear of closed spaces, fear of injection, fear of spiders, snakes, and so many things, elevators. So you have to work according to their problem.
So I'm going to ask one question and then I'll ask Yusuf Bhai. Is that okay, Nasmo?
Yeah, go ahead. We'll cut off at 5:26. I was going to say we'll cut off at 5:30 because I don't want to be unfair to Dr. Noorani.
No,
okay,
I'm good at all.
So I'll ask these questions very quickly and rephrasing the question, right? So I'm not going to read the whole question, right? So can you let us know if divorce is a cause of mental illness, or just explain divorce?
Divorce, okay.
Yeah. So if you can just drill into it and tell us how it affects mental illness.
Divorce?
Or
yes.
Or can mental illness lead to divorce?
Yeah.
That sounds better.
That's a good one.
Sorry. Divorce. Again, it's a traumatic event for someone's life. It's not life-threatening, so it should not cause post-traumatic stress disorder. What it causes is that it's called acute stress disorder. So it causes stress. Yes, it's just like losing your job, losing your loved ones, or losing your spouse, basically, right? So losing a loved one, losing your relationship, they all can cause stress. Stress means anxiety, basically. Again, is it going to cause so much anxiety and stress that you really need treatment for that? I don't know. Again, as I said, everybody's tolerance is different. People I've seen, they get divorced, and some people are very happy. Actually, recently I got a call from somebody say, my wife left me, and honestly speaking, I am very relieved. Sorry to say. And I say, oh wow, okay. So for some people, relationship could be very stressful, and for some people, the relationship could be very comforting. And then when they break the relationship, it could be very distressing. So for those people who go through distress, anxiety, they lose their sleep, they don't eat, they feel depressed, hopeless, helpless, worthless, then yes, you need help. Is it always going to cause mental disorder or depression? I don't think so. Because again, I believe it's a normal phenomenon in our life. There's actually more than 50% divorce rate in North America, unfortunately. So it's very normal. 2 out of 1 couple will get divorced or get separated. So it's very common. So people should not distress about it. But again, it's a natural thing to happen. I mean, natural thing to get distressed if you're getting separated or break up with a loved one, whether it's a spouse or any family member. But again, it should not last very long. You need to accept the reality and move on.
So should we give Yusuf Bhai a chance to ask questions?
Yusuf Bhai, he is the big boss. So last question to Yusuf Bhai.
Oh, thank you very much, sir. Thank you.
Yes, Yusuf Bhai.
I was kind of interested when you're talking about the blood levels in the brain.
Oh yeah. Blood level.
I remember about 30 years ago when I was teaching in Hartford, Connecticut in the US.
Oh, I lived in Hartford, Connecticut.
Oh, really?
Yes.
Wow. So anyway, I was teaching 7th and 8th grade, which was a very tough age to teach in a very disadvantaged area of the city.
Yes.
So the kids were rough,
Yes.
and I was getting the brunt of it, So one day I was tired and I went to the bathroom, teacher's bathroom, and I felt like sleeping. So the only place I could find was the floor.
Oh.
I slept on the floor. And a colleague of mine was looking after me and because my class had just arrived and I wasn't there. So he came to the bathroom and saw me and called the ambulance, and I was taken to the emergency. The long short of it is that I was told I was short or less potassium in my brain or my blood or something like that.
Oh, yeah.
So I was given what is called a slow K tablet to keep in my tongue.
Potassium supplement, yeah.
Uh-huh. So I asked my doctor, I said, why did I get slow K? Why did I get less potassium? What did I do? Did I eat something wrong? Did I do something wrong? He said, no, nobody knows what is the reason. So do you think this shaitan or iblis has control over my blood chemical levels?
A lot of people ask question why, what causes it. And in medical science, actually, people think that we know too much about it. And actually, honestly speaking, we don't know much about it. For commonest disease, for example, diabetes. If you ask me, what causes diabetes? I say, oh, lack of insulin. What causes lack of insulin? Oh, because your pancreas is not working properly. Why your pancreas is not working properly? I don't know. So the answer is I don't know. Basically, most of the questions we don't know the answers. So potassium, lack of potassium, it's called hypokalemia. What causes it? I don't know. It could be some deficiency of some kind of nutrition. Sometimes what happens is some food can excrete some elements from your body, sodium, potassium, calcium, magnesium, whatever, and then that can cause deficiency. But I don't know what causes. For example, people say there's a lot of potassium in banana, so if you have lack of potassium, eat banana. That's true, actually. There's no harm in eating banana if you need some potassium, or if you need some magnesium, you can have magnesium salt, magnesium tablets, magnesium powder. If you need some calcium, there are calcium. So I don't know what causes these deficiencies in our body. Most of the answers are we don't know. But yeah, your low potassium can cause death too, actually. It can stop your heart.
Yusuf, Shaitan is enter maybe.
You have to ask Malala Rizvi about that.
Okay. All right. I think.
Thank you very much, Dr. Saab. Thank you.
No problem. My pleasure.
On that note, I think we have to call it a day. 5:32 in Toronto.
I have a couple of more topics to go. Anxiety disorder, dementia for old folks, Baraza is for old people, right? I thought I've prepared a very well topic on maybe next time, inshallah.
Exactly. That's
Inshallah.
what I was going to say. You have to come back, and next time we'll sort of zone in on just a couple of topics.
One topic, I can, yeah, exactly.
It is such a wide field, right? It is such a wide area. So we'll certainly do that. And you know, whatever you cover, it's amazing. You know, you certainly educated us, cleared our minds on a few things, few issues, whatever, answered our questions and whatever. And I see all those thank yous coming in, you know, on the chat.
Yeah, I see the messages again. Thank you very much.
So
Okay,
everybody,
so-
thank you very much, and you know, have a safe summer.
You're welcome.
Right. So, Naushad bhai, we'll talk later. But again, really appreciative of your time and, you know, such a beautiful presentation. Thank you.
My pleasure. I think we should focus on one subject next time, inshallah.
Absolutely. Absolutely.
Inshallah.
Thank you.
Okay, thank you very much, sir. Thank you a million times.
Okay. Have a great summer, and we'll be in touch in September. Thank you.
Inshallah. Hafiz.
Okay.